licensed in Florida and Alabama, and we do quite a few rejuvenation, beauty events and Botox shows in both of those states. Nationally, we can serve you via conference call, Zoom, or what have you for any of your hormone needs, skin recommendations, weight loss needs, DNA weight loss, and any of the other preventative medicine measures that we offer. It's always a pleasure to serve you, and as you may know, we talk about everything on our webinars, from hair restoration to beauty and skin rejuvenation to weight loss and weight loss control with your DNA, as well as hormones and the whole plethora of what hormones can mean to both males and females. We do review erectile dysfunction and all of the new parameters that are available for that, and it's just a new and different day. We no longer have to rely on the blue pill, which for many men doesn't work or doesn't work or not. So if you're suffering with something like diabetes or blood pressure or some other condition, or if you've just lost a lot of stamina and you're fatigued, give us a call and let us see what we can do for you, your male hormone needs, testosterone, erectile dysfunction, and the like. With ladies and female menopause, we fine-tune the bioidentical hormones. We use creams, and there's a large variety of reasons for that, so that we can get you looking and you're feeling your very best at any age. Tonight, we're going to do some facial rejuvenation and make that face look fabulous with just a little bit of fillers. So whether you're younger and you'd like to have higher cheekbones or a little bit more prominent chin or any of the other things around the face, when you're a little bit older and more mature, we're actually filling back in the face that tissue that may have been lost over time. So by popular demand, we've been requested to do some before and after show and tells, live demonstrations and testimonials. So you ask and we deliver. Please don't forget for our videos, whether it's here or on YouTube, please like and share to be entered into a contest. Today, the first 5 people to share are going to get a complimentary bottle of C Power 2000. That is vitamin C in a powder, active buffered form, and when you add it to a juice or water or any other beverage, that's going to go back in and repair the collagen that we're losing every day. If you're interested in any of our products, you can click the link in the description, store.skinbodyhealth.com. If you're watching from Instagram, TikTok, or one of our other social media outlets, go to the store link in the bio below. So it's skinbodyhealth.com. If you missed any of our previous webinars over the last few years, our YouTube channel is Dr. Birkenstock's Skin Body Health. That's Dr. Birkenstock's Skin Body Health. So just a little bit about the skin. So if I sleep well and live a pretty good lifestyle, why am I noticing wrinkling, crinkliness, creepiness, or just my skin doesn't look the same? Maybe my pores look larger, or it's more dry, or it's more oily, or any of the other multitude of skin changes we see with time. Or, and I so compliment the younger generation, young ladies and men are coming to me earlier now and saying, I don't want skin that looks like my grandmother, my great aunt, what have you, or that I see in the community on some of the older ladies. What can I do now to prevent those problems from happening? So accommodations for the young folks that are asking. For the more mature ladies and gentlemen, it's not too late. We can help you repair your collagen in natural ways, and then also with supplements. And then if we need a little repair, we can do procedures like broadband light BBL, IPL, intense pulse light, radio frequency needling lasers, as well as chemical peels. So we're always happy to do a complimentary consult and to kind of lead and direct what may be some good avenues for you. About collagen, let's back up and talk about that. So if you're going to take supplements, what are the main top 3 things you can do in the supplement topical category to care for your skin? Well, first of all, when you're shopping for supplements and lotions and potions, make sure you're using a quality medical grade. Because if you're not, you could be swallowing a calcium that's basically made 90% more of chalk. So therefore you're making the company a lot of profits, but you're not doing yourself any favors. So make sure you look for the GMP seal of approval. I'll show you that in a minute as I get closer to you. And so that you're getting a high grade. The GMP seal of approval ensures that the potency and the milligrams you see on the label are in fact in the products that you're using. Without that, supplements are considered foods by the FDA, and they can basically put anything in a jar that doesn't harm you, and well, they can sell it that way, and it's perfectly fine. I don't think it's ethical. However, as long as they don't harm you with their product, it's considered a food supplement over the counter, and there's no rules or regulations above and beyond that. So I'll give you an example. In some of the national vitamin books that grade the vitamins, there's Centrum Silver, and 0 out of 5, it's rated a half, 1/2. 1 a day is rated a half. Some of the Walgreens vitamins, which is a national drugstore, are anywhere from 1/2 to 1 to 1.5. Nothing in the 3, 3.5, 4, 5 categories from the aforementioned. GNC is in that category as well. So this is a national publication. We can put it in our website if anybody would like to review it. I'm not trying to pick on any of the brands. This is just what the national ratings are telling us, and I'm sharing that factual information with you. So when you're shopping for vitamins and topicals and cosmetics or cosmeceuticals, please make sure you're using a good grade, a good medical grade, because the last thing you want to do is put something on your face and in your body that in fact takes away from your natural collagen and health. So without further ado, today we have our collagen bundle. And with that collagen rebuilding bundle, we're going to recommend vitamin C powder, collagen supreme, which has got multiple varieties of collagen in it, and our vitamin C topical serum. Where's the bone broth? And the vitamin C topical serum. Some of these things you can get from your natural foods, but it's very hard unless you're eating those foods every day. For example, when you're eating a food, if you're making a stew or a soup or anything with that's something that you're going to need a chicken base or a beef base, excuse me, I would highly recommend bone broth. And when you're shopping for a bone broth, what you want to make sure of is that you get one that's organic, gluten-free, not a lot of salt, and no artificial ingredients. I particularly like the Zoop brand. I have no financial interest in them. It's just a good, clean brand that I've found. I'm sure there's many others in the market. So instead of using a chicken stock or a beef stock that's loaded with MSGs and salts and other artificial ingredients, or even like a canned soup as well, try to either make your own bone broth, or get a bone broth that's a very good brand, organic, without all the junk and artificial fillers in it, and low salt. So that's what you can do in your natural way. The other places you can get collagen are from anything that's got bones in them. So for example, fish, chicken, beef, all of those high protein things have a lot of collagen. And of course your dairy eggs. So if you eat eggs, hard-boiled eggs are absolutely fabulous. You're going to get those heavy, high doses of collagen as well as proteins and albumin. The amount of good things that you're getting in terms of albumin, collagen, protein from an egg far outweighs the cholesterol. If you have a cholesterol issue, I do recommend eating your eggs in the earlier part of the day so that any cholesterol you may pick up, you're going to energetically help to walk or move around and burn it off. So just don't eat your eggs at night. So collagen sources, those are some good ones. Anything, remember, with a bone in it. Fish, turkey, chicken, beef, lamb, venison. And if you're cooking it at home, keep the bones and then boil the bones down so you can make your own natural bone broth, and you can put it with your soups and stews and other things that you may or may not be making. Okay, vitamin C. let's go on to vitamin C. So vitamin C powder, rarely get enough of vitamin C. Vitamin C is found in fruits and vegetables, especially colorful ones like red and green bell peppers, oranges, mandarins, and things like of this nature. So broccoli also has some nice vitamin C in it. We rarely get enough vitamin C from our normal diet. So vitamin C is wonderful in terms of health and anti-aging. But in addition to that, when you put that vitamin C on topically, vitamin C, our topical serum, that it works twofold. Number one, naturally, vitamin C is a natural sunscreen. So by putting it on, it doesn't take the place of sunscreen, but it certainly enhances the effects. It does have some mild protection from the sun. In addition to that, the vitamin C topically also helps rebuild and repair collagen. So when you swallow the vitamin C, either through your fruits and vegetables and or your vitamin C powder, you're going to rebuild your collagen from within. When you put on your topical vitamin C, you're going to help rebuild your collagen and block the sun from topical or without. And again, your collagen. You want to swallow your collagen, whether it's from bones, bone broth, proteins in your foods, and your collagen powder, so that those big doses of collagen can help rebuild. What we do know is when we get younger, when we're young, we naturally rebuild collagen 2, 3, and 4. As we get older, we don't make enough of collagen 2, 3, and 4, and we lose more than we can possibly rebuild. So that's when we want to swallow extra collagen. So make a more effort toward eating the fish, the turkey, the chicken, the beef, or whatever it is that may be to your diet. Of course, if you're totally vegan or whatever, don't change your diet. Follow your belief pattern, but please add to your collagen by supplementing protein powder so that you know you're getting that help to boost the rebuilding of collagen. So vitamin C topically on the face. Again, you would take that vitamin C serum and place it and apply it in the morning. You can also apply it in the evening, but specifically in the morning to help protect the skin from the sun and the environmental pollutants, as well as rebuild that collagen. So, the other thing I wanted to share with you is when we're out in the sun, always wear a hat, because a hat is going to give you a level of protection that even a sunscreen can't block. So of course we're going to pick up our sunscreen, 30 plus or more SPF, and in that sunscreen we're going to make sure we have a sunscreen that contains zinc and or titanium dioxide, because zinc and titanium are the two ingredients that are truly sun blockers. All the rest of them, the oxybenzones, neobenzones, we could go on and on and on. Those newer agents are lighter and more sheer. However, they are sun screens. They're not sun blocks. Therefore, you may not turn red, but the skin cancers can still, the radiation still comes in and can cause skin cancers, and you're still going to age unless you've got a product with titanium or zinc in them. So please look for titanium and zinc, one or the other or both, on your product label. And there actually are showing now with some of the benzenes, benzones, and all of the other popular ones that you'll see in all the products in the drugstores. They're nanoparticles, which mean tiny, 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 and they are actually entering our skin, and they are doing research right now to see if it might not be related to actually body organ cancer. So something you may want to think about for the future. People used to avoid titanium and zinc because it was white, bright white, and nobody wanted to walk around with a bright white face. The lovely thing now in our sunscreen and many of the ones on the market, ours is pure titanium and zinc. It's a purely minerals meaning titanium and zinc, sunscreen, and we order it, or I manufacture it tinted. So if you're darker skinned, it won't be too white. If you're lighter skinned, it won't be too dark, but just enough of a tint to sort of block that high white pigment out of it. In addition to that, what else can we do to block that sun from causing not only skin cancer, but of course aging, wrinkling, enlarged pores, creepiness of the face? Well, visors. So there are a couple types of visors. The ones I like have a big beak. And with the big beak, so this is a normal visor, okay? Normal visor that you can get at any department store, okay? And they're usually about 2 inches, the brim. Here, this brim is 5 inches. So it's got a little bling on it. But what you're seeing there is you're going to get much more exposure, and it's going to actually cover the chin. If you don't have a visor with a long, or what they call a wide beak, 5 inches or more, then from your nose down, there's many times when you turn your head, or if you're in direct sun, where that sun is going to beat on the lower face, and you'll actually see more advanced aging on the lower face, especially in golf, tennis players, joggers, and the like, than you'll see on the upper face that was protected by a smaller beak. So you can order those online. They're not expensive, but any hat is important than no hat or visor at all. But when having the option, you can order a visor with a longer beak, 5 inches or more, and you know it's going to cover you from the nose down and give you more protection. You can actually get it here from our office, but also feel free, just Google wide brim hats and order one on your own. So tonight, without further ado, we're going to be doing a demonstration on fillers. So when we're talking about fillers, we all lose tissue over time, or fat, and it falls to places we don't like, maybe in the lower jowls, or maybe we've lost a lot of weight, what have you, but it begins to sink. So what we can do then is replace it with fillers. This avoids the need for expensive surgery that may not come out as you like it, and if you don't like it, there's really no turning back. So we're going to welcome Michelle on the stage with us today. Michelle, if you'd have a seat right here. Hello, hello. It's a pleasure to see you. And, yeah, this one, Anthony? Yeah, we're not. Let's see. Okay. You're fine. Yeah. We're going to be injecting a product called Radius. Radius is it's actually the premium filler. And there are many of them. There's Voluma, there's Restylane, bunch. I particularly like Radius. It's made from calcium hydroxyapatite. It's a little bit, has more volume than a hyaluronic acid, and it stays much, much longer. And it helps to increase collagen naturally. I'm sorry, the other way. So we all have calcium in our bodies, and this product's been used for years and years to repair vocal cords and knee ligaments. So before it even came in the beauty world, which it came in approximately 2000, it's been in the repair world, orthopedics and ENTs, for a lot longer. It's a beautiful product. It feels lovely and stays a long time. It can last actually a year to a year and a half. So, and we'll have Michelle's before and after pictures on our website. Okay. So let's see, Michelle, let's turn this way. So if we look at Michelle's face, gorgeous, absolutely gorgeous face. She's had a little bit of changes over time. So what we're going to do is we're going to lift those cheeks a little bit. And by lifting those cheeks, it's going to soften the lines around the mouth. So there are a lot of practitioners that will actually go directly after the lines around the mouth. No harm, but the most natural look is always going to be when we lift the cheeks first. By lifting the cheeks first, we're actually lifting the mouth without even touching it. So then we have much less work to do when we come down to the mouth, and the overall look is much more natural, much more beautiful. Okay. Relax if you can for me. Watch that purple finger for me and just measure it. Okay. You can close your eyes if you want. You're going to hear a snap, crackle, pop. I tell the patients they're going to hear a snap, crackle, pop. When you're placing the product, you can sort of hear that. And if you don't warn them, they're very alarmed. Going, what is that noise that I'm hearing in my ear? Did you hear the noise?
I heard it.
Yeah. Was it painful?
No, not at all.
All right, good. So I put a half of a tube into the right cheek. Now I'm going to put a half a tube in the left. And as you can see, fillers are a very fast procedure. They take no time at all. And if I wasn't talking, it would probably be less than 3 minutes. I always look for asymmetries when I'm injecting, because if someone has a predominant side that they sleep on, that side is going to be flatter or have lost a little bit more fat than the side that we don't sleep on. Also, if someone drives for a living and does a lot of driving, same thing. The side they drive, so obviously the left side, would have more tissue changes than the right side, for example. Yeah. Oh, that's looking beautiful. All right, now I'm going to come down to the lower mouth. Okay. I'm going to soften these nasolabial folds a little bit. Open for me. I'm going to massage the material, the radius right where I want it. Your fillers are very malleable or movable for about 48 hours. So what you want to make sure of is that you mention to the patient to sleep on their back with a couple of pillows. You don't want them touching it or falling asleep on the area of the face that you worked on, because it could move. Open. So I just tell them sleep up on a couple of pillows, put a sofa cushion on either side of you to keep you on your back if you're someone that moves a lot. And we haven't had any problem in 20 years.
Oh, good.
Yeah. Okay, so we're going to come across to the lower left mouth at this point, and we're almost done. She's doing great. Open for me. Okay, go ahead and close. Open for me. Okay, close. Open. Awesome. And close. If I've got a deep etch line, I go ahead and pop it out a little bit. Open. And close. Open. And close. Good. Perfect. Okay, so we've got 2 tubes of filler in, and we've lifted the cheeks up beautifully. There, of course, immediately when you inject a product into someone, it swells a little bit, but there's no heavy bruising. She's got a glow, and we've come all around the mouth. So we've put in 2 tubes of the product called Radius, and she's done quite well. Was it very painful, Michelle?
No, not at all.
Okay, good, wonderful. And she looks absolutely great. Beautiful thing about fillers, lots of times my ladies go home and a month from now they go, I love that and I want more here or here, but I guess it's too late. The best thing about fillers is you can always add on. You can add one once a week, once a month, once every 3 months, if you decide that you want higher cheeks or more work around the mouth, what have you. But the fillers are great. They can take 10, 20 years off the face in a matter of 3 to 5 minutes. And as you can see, it's such an easy procedure. She can very easily spot on a little touch of makeup and go out tonight. The thing that she wouldn't want to do is wouldn't want to have a lot of alcohol or ibuprofen or aspirin, fish oil, or vitamin E, because those are things that can kind of tend to aggravate bruising. It wouldn't harm her. She might get a bruise that she ordinarily wouldn't if she weren't on anything that tends to thin the blood a little bit. But again, it wouldn't harm her if she did. But that's one of the things that you may want to encourage patients to let them know about ahead of time so that they don't have any unanticipated bruising. So, thank you guys for tuning in as always. Yes. Are there any questions?
Can I get fillers if I've had a previous facelift?
Oh, that's a great question. Yes. Matter of fact, there are a lot of plastic surgeons that send their clients to me when someone is out 1 year, 2 year, what have you, and they're noticing just a little bit of wrinkling here or there, or a little bit of creepiness here or there, because you can't keep going in with plastic surgery. It's not something that's recommended. And for the little tiny lines and furrows, or nasolabial folds, or wrinkling around the face or in the glabella, if those do form, no, you absolutely can do Botox and filler, and it's highly recommended for those small things, because even when you do major work on the face, there's always going to be touch-ups after that are needed for those little spots. So surgery can do so much. Surgery is a lifter and a smoother, so it can pick up the skin, but it can't erase every single line. It's sort of like when they do that parchment and that special type of icing on cakes. It takes a lot for them to get that perfect wedding cake look, and over time it loses its shape. If it were a human, again, it would be just like having a surgical procedure. Then you need touch-ups after. Yes.
Do you do fillers to fix asymmetries?
Absolutely. So we can do fillers to fix any kind of asymmetry. I've done it many times. I've done it with unfortunate situations where someone may have had a stroke and we rebalance the face. Some people are just naturally born with a chin that's a little longer on one side, or a cheek that's a little higher on one side, or even an eye. So if someone comes in with a higher right eye and lower left eye, or vice versa, we will simply put some filler behind the opposing eye, which will lift it up and make it match the other. Yes. Yes.
How long does filler last?
Well, it depends on which ones you're using. So if you're using a hyaluronic acid or like Restylane, Juvederm, Voluma, and there are a multitude of others. Those are all hyaluronic acids. Hyaluronic acid sounds like a big, strange, scary word, but it's really just proteins found in the body. The particular one we use tonight, and those usually last anywhere from 4 to 9 months. It depends on the product. It depends on how many times you've used it. Different, or in contrast, tonight we used Radius. Radius is the different one. It's not a hyaluronic acid protein. It is found in your body. It's a soft calcium, and it's calcium hydroxyapatite. It lasts longer, builds better, and it forms like a webbing or network to your collagen. So it's the gift that keeps on giving. So when it's attaching to your collagen, sort of like a little barnacle, it's encouraging your collagen to rebuild a little bit. So therefore, it stays longer. And even when the Radius gel has sort of evaporated over time, the collagen rebuild that you've got, however much you did get, is there to stay until, of course, the aging process over years and years and years. So it's a great product. Radius, again, the first time you use it, maybe 9 to 12 months. When you're going on top of it sequentially, in the future, you usually get much longer, 12, 20 months or so. Okay, well, thank you guys for tuning in. We certainly